One of the first things that neuroscience students are taught about neuroanatomy actually isn't true. This idea is that if you have a lesion, some sort of surgery, stroke, etc., in an area of the brain called Broca's area, that it will lead to this devastating aphasia or problem speaking we refer to as Broca's aphasia. Broca's area is classically defined as the pars triangularis and opercularis of the inferior frontal gyrus. And Broca's aphasia is this speech syndrome where you're able to understand speech, but you're not able to produce speech or meaningful speech. And over here we have an example of someone who had a surgical resection directly in what's classically referred to as Broca's area, who had almost normal speech after this surgery. What we did in this study is we looked at the surgical resections of patients with brain tumors who had awake brain mapping surgery to protect speech, and then they were evaluated for their language before and after surgery. And then we aligned the postoperative MRIs, the resections, onto a common brain space so we can see which resections were most associated with which speech deficits, like Broca's aphasia. And what we have on this top row in red here is the areas of the brain which, when resected, were most likely to be associated with this deficit, Broca's aphasia. And as you can see, it's actually distinct from this white outlined region, which is the anatomic seat of Broca's area. So people are having this aphasia, but it is not because of resections in Broca's area. Again, on the top line here, what we have are resections that included anatomic Broca's area, and the two most likely outcomes when people have resections in this area with awake speech mapping are either normal speech or some subtle anomia, which is kind of tip of the tongue syndrome, a little bit of difficulty with naming. Patients who actually did have Broca's aphasia after surgery, and we found that this is actually quite a rare deficit that happens after surgeries, but it's not associated with Broca's area. It's actually associated with resections that are more posterior to that. So dissociating this anatomic area, Broca's area, from this aphasia syndrome, Broca's aphasia. So if you're learning about neuroscience in class and someone tries to tell you that lesions to Broca's area lead to Broca's aphasia, feel free to cite this paper and educate them on what modern neuroscience thinks about this.